I don't know how many of you think you've figured out what's going on with your health insurance, but I know I haven't.
The Dan York State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
This is clearly one of the things that is pressing on the minds of just about every American citizen, at least those who are responsible for the fiduciary end of the family's health care. And there's all sorts of campaign threats from Donald Trump as to how Obamacare is going to be dismantled, yet a couple tenets that are so important to people, like young people staying on the family plan and pre-existing condition protection, seem to be still in the Republican plan. And so it's, you know, we're coming and going. We don't know what the heck is going on. Our guest tonight will help us walk through some of what he sees as the perspective of transition between Obamacare and Trump care? I don't know if there's a word. So Dr. Johnny Liu is here, who has a business for profit where he, well, you know what, he'll explain it to you. It's because everything that has to go with health insurance is kind of confusing. I mean, how many of you, if I give you a quiz between Medicaid, Medicare, and all the programs that are out there, what Obamacare really provides for you, would be able to pass that test? I don't know. Anyway, welcome in. It's nice to have you aboard. Thank you very much for joining us on this, the darkest day of the year. It is the first day of winter, December 21st. The good news is every day from now becomes a little brighter. You know, I got married on this day. Yes, it's my anniversary. Thank you very much. My wife's actually here for the first time in 3 years watching the show, because we're taking the radio afternoon off and celebrating her being my light in the darkest day. You like that, Lex? She's heard that line before, so it's no big deal. All right, let's go to the rundown and just check on a couple of things. This is an important story, and it's going to test the leadership of Jorge Elorza, who, by the way, has not passed my test for leadership on many issues in the city of Providence. Headline in the Providence Journal today: charter school growth gets okay. And here is, I think we've got some audio on this, do we not? Yes, we have some audio on this describing Jorge Elorza's perspective on this particular problem that he faces now, with Achievement First being the institution that's growing by leaps and bounds in Providence, with the okay now from the state, but he's hesitant.
Priority as mayors to make sure that all of our kids receive the highest quality education. And so there are two aspects, right? The first one is making sure that kids are at Achievement First schools today get to graduate from Achievement First middle schools and high schools. However, with a third Achievement First school opening, that would have a crushing financial impact on the district. And you know, we're going to work together, see if we can raise the money for it. But that can't go forward if it's going to impact our ability to educate the other 25,000 kids in the public school system in Providence.
Here's the thing. We have a formula in Rhode Island where the money follows the student. So as a student leaves the traditional public school system to join a charter school, which is a public school, the $12,000, $15,000 a head calculated for that student moves to that Achievement First program. So the calculation is by 2025 there'll be some 3,100 students in Achievement First, and it'll gut the system by $35 million. The mayor is suggesting that Achievement First is somewhat responsible to help him come up with the difference in the money. No, they're not. They're responsible for educating the kids. He's responsible for leadership and being a change agent and changing the status quo and all of those things. So it'll be a very interesting development over the next year or so to see how that plan works out. But good for the state board to thumbs up this program. Progress will only come with change in education. I think everybody knows that instinctively. This is just nonsensical. I don't understand this. This is the Merry Christmas bill. You know, Texas passed this bill back in 2013. And Patricia Morgan, who, you know, I have a lot of respect for her. She's an often guest here. She's the new minority leader. Puts up a bill for January to make Christmas something that you can legally talk about in the public school systems and on public properties. There she is, sometimes courageous, sometimes a troublemaker, sometimes a time waster. I don't understand what the issue is here. Right now in Rhode Island, you can have a Christmas display. You just have to balance it with those who request a secular display. We went through this in the city of Cranston quite some time ago with Mayor Laffey, who even had pink flamingos on the front yard of City Hall. Sans some kind of crisis or controversy, like what teacher got jammed up for telling her fifth graders, hey, guess what, Santa's coming, or Merry Christmas? I haven't seen it. What protest occurred when somebody said Merry Christmas? Now, we're all still hungover from Link Chafee's Christmas tree turned holiday tree, I know that, but this bill is an answer to a problem that doesn't seem to exist. If you want to say Merry Christmas to somebody, whether you're a teacher or just a civilian, I give you permission, and we don't need a bill for that. By the way, first bill for the change agency of the Republican Party is a Merry Christmas bill. I don't know, it seems to me we've got some fiduciary problems out there that might garner better attention. All right, speaking of finances and money, year-end health care is a question for everybody. Here's the latest in what Donald Trump told 60 Minutes in this transition period.
Are you going to make sure that people with preconditions are still covered?
Yes, because it happens to be one of the strongest assets.
You're going to keep that?
Also, with the children living with their parents for an extended period, we're going to
You're going to keep
very
that?
much try and keep that. Adds cost, but it's very much something we're going to try and keep.
And there's going to be a period, if you repeal it and before you replace it, when millions of people could lose.
We're going to do it simultaneously. It'll be just fine. We're not going to have like a 2-day period, and we're not going to have a 2-year period where there's nothing. It will be repealed and replaced, and we'll know. And it'll be great health care for much less money. So it'll be better health care, much better, for less money. Not a bad combination.
What's he talking about?
I think we're all trying to figure that out. So essentially, it's a lot easier to stay behind a trend and ride it versus trying to create your own trend. So what's happening in healthcare nowadays is that things are getting very, very expensive for a lot of people. It doesn't matter if you're on Medicare or if you're under 65 and you have to go through either an employer's work plan or a standalone plan from one of the Obamacare exchanges. Things are getting very, very expensive. And what we're seeing is that we're seeing this transition to more of a consumer-driven healthcare, where what that really means is that you're going to be paying for the first X number of dollars for your health.
By the way, welcome.
Thank you.
Nice to have you. You run an organization called you're the president of Doctor's Choice. That's your gig. That's your company. Give me the cliff notes on what it is and how it works.
Sure. So Doctor's Choice, what we do is that we help retirees navigate Medicare. And I started it really out of medical school based on a lot of frustration that I had about the healthcare industry, how confusing it was for seniors to choose various Medicare plans. And I was seeing it in the clinics, in the primary care office, where people were asking us, what plans do you recommend? What plans do you take? What should I go on? I really didn't have the answer. So I created this organization as a way to really educate people about what the common trends are and what to do.
So you're not practicing?
No.
Geez, I had all sorts of issues I wanted to discuss with you.
I still get that a
thought
lot.
maybe you'd take my blood pressure or something, Tim. I'm like,
People show me their feet a lot.
But they show your feet?
I got this thing on my foot.
Yeah,
Can you take
right.
a look at it? And
Is that a trending problem in
It's a
America
trending
today?
problem,
Things
yeah.
well, you know what? I got
The socks flying off
I
in the
got ugly
office.
feet, I can promise you. But, well, that's really, that's a fascinating thing. So you started out professionally with one thought and then made a transition to the business of medicine.
Yeah, I felt like, being in a clinical practice, you can help, in a primary care office, 1,000, 2,000, 3,000 patients max. And what I was really frustrated at with was what the system was becoming. And I wanted to do something to really change that. And what that meant was, how do we make healthcare more understandable first, and then how do we make it more affordable afterwards?
So for full disclosure, your income is derived from the insurance industry, correct?
Correct.
How so?
So the insurance companies pay us when we help somebody enroll in one of the various plans. And our mission is to take an unbiased view. We work with all the major insurers, and our goal is to help somebody navigate through it and pick the right plan for them.
So what are you like, the equivalent of a travel agency?
Similar, yeah.
In some ways? So people come to you and say, here's my status, me, my wife, my family, blah, blah. What do I do?
Exactly. Yeah, we take a look at three major components. When somebody retires from work, we work with a lot of the big employers in the state. And when somebody retires from work, we take a look at their health. We take a look at what medications they're taking. We take a look at what they plan on doing after retirement. And we customize a plan for them based on those 3 key criteria.
And the customer doesn't pay you, the insurance companies do.
Correct. Yeah, it's no charge to the customer, and we stay with them for life.
That's a hell of a model. Pretty smart.
Well, when we first started, to stay unbiased, we wanted to develop either a nonprofit, which at that time it was sequestration, so there was no money being given out for grants.
Right.
And then also on top of that, people around the country were charging, attorneys were charging $1,000 per sit down for a service like ours. And I realized that people that really needed it couldn't afford it. So what we wanted to do was we wanted to adopt an existing business model to provide that service.
All right, well, listen, I've got a lot of, we could go on all night, and we'll make the most of the time that we have left, and there's plenty, to talk about some of the trends, the transition between Obama and Trump, some of the key things happening here in Rhode Island, like the healthcare exchange and all those kind of things, with a doctor who doesn't practice, but who advises still. First, I just want to let you know, if you're thinking about, and perhaps Thanksgiving, it was just a little crowded in the kitchen, or you're planning the holidays here and you got a lot of folks coming over and you're thinking, you know what, it's about time that we change this kitchen so that it accommodates the guests a little bit more. Or maybe just it's hectic at the beginning of the day getting everybody out smoothly. Or maybe you just want to add value to your life and to your home. Cumberland Kitchen Bath Design Center would be a great choice for you. I can promise you the work will be on time and on budget. It was for me. Go to cumberlandkitchen.com and take a look. We'll be right back.
When I came into office, 44 million people were uninsured. Today, we've covered more than 20 million of them. For the first time in our history, more than 90% of Americans are insured. In fact, yesterday was the biggest day ever for healthcare.gov. More than 670,000 Americans signed up to get covered, and more signing up by the day.
Yeah, so President Obama was trying to explain the other day, that was just his last press conference, that things have gone well with this whole thing. What is your grade, A to F, on whether Obamacare has gotten the job done?
I think great intentions, but it didn't address the core issue, which was the cost of health care. And for the millions of people that are covered, I think if you got subsidies or if you were on Medicaid, which is a program for low-income individuals that was expanded during the program, it was great because it's as if you had health insurance like health insurance was in the past, where you just go and you didn't have to pay anything. But for a lot of the middle class, especially a lot of small businesses, they really got hurt because the prices went up, the deductibles went up, and I think a lot of people are left holding the bag. So we're a small business, and for me, just for my family of 3, we're young, knock on wood, we're healthy. My healthcare costs are in the 5 figures out of my own pocket every single year. So for a lot of small businesses, the backbone of America's economy, to be able to foot that bill, it's incredibly difficult.
So we have 3 categories, it seems to me, of health care in this country right now. Those who are healthy, well, families and individuals who are seeking, for lack of a better term, pre-retirement health care. Mm-hmm. Medicaid, which comes in on a disability basis and then a senior basis as well.
Medicare.
Well, Medicaid is for the disabled, and who else?
So Medicare is for people who are disabled for 24 months or those who are 65 plus. And then Medicaid is for people that have very low income.
Well, I'm sorry. Okay, so Medicaid is low income. I actually knew that. Medicare is the retirement program.
Correct.
That everyone is going to get on. And we've been paying continually through our payroll for that particular service, right?
Exactly.
But it feels like a big cliff for a lot of people because most folks, myself included, have health coverage, health insurance through their employer. And then there's that middle ground of the small businesses and the individuals who work for companies that don't provide health care, where they go to the exchanges now under Obamacare. Mm-hmm. And Rhode Island is one of those entrepreneurial states that's actually doing it themselves. Have you followed what's going on with the health exchange in Rhode Island?
I have, and we actually work pretty closely with HealthSource because we have a lot of folks that come to us that are under 65 that we can't take care of because they're not going on Medicare, so we triage them over to HealthSource. And
are you bullish on it?
You know what, I think that out of all the exchanges that are out there, it's one of the more well-run ones, and it's one of the few ones that haven't been folded into the federal government. So you still have something local. In terms of whether I'm bullish on HealthSource moving forward, I think that in its current state, it is going to I do anticipate that it is going to stay around, and I think that they've got some pretty good people running it. So I am hopeful for where it's going to go.
Donald Trump is threatening to suck out a lot of Medicaid money. What's your thought on that?
Well, I think that it's not as easy to do, because what ends up happening is that it's a whole domino effect where people are going to lose funding, all the healthcare institutions that depend on Medicaid dollars. And in terms of healthcare spending, over 50% of healthcare can be traced back to some type of government spending, whether it's the federal or the state government. So you're going to see a huge domino effect on the economy, especially when healthcare is over 18% of the GDP in the United States. So I don't think it's going to be as easy to cut back on that.
Meaning we're in too deep.
Exactly.
Yeah. Gee, are you suggesting that Donald Trump is making a kind of a promise that when he finds out the realities of it, he's not going to be able to execute or keep it?
I think he's very
I can't
smart at
believe
writing
that.
trends.
Yeah,
Right.
Right.
Exactly.
The whole damn campaign has been all about that, it seems to me, and then kind of pulling back. Do you think it's still a worthwhile investment for the Rhode Island taxpayers to keep that health exchange independent from the federal government if the opportunity continues to present with the Trump administration? You want to stay on that course?
From an entrepreneurial perspective, I think so, because I think that when you have a state like Rhode Island, we talk about this all the time, and I hope that we actually get to do it, which is take what we have, this infrastructure that we have here in Rhode Island, being a small state, being that everybody knows each other, and actually pilot innovative projects with it. Because in Rhode Island, you have only a select number of healthcare systems, a select number of health insurance companies. They all know each other, and for something like HealthSource to be independent in Rhode Island and to formulate innovative programs, I think it has a lot of potential.
All right. You wrote, the doctor has a book. I have a picture of it, I think. The Retiree's Guide to Medicare. I actually saw the title and went, thank God. Thank God, because sooner or later, I mean, I'm probably 10 years away, and it's a real easy read. People need information calms people, right?
Right.
And this is a how-to in terms of getting involved in Medicare. We'll talk about that when we come back. And also, the Speaker of the House, says we're repealing and replacing, but I don't know what the differences are. Stay with us. Now, adding to the confusion are interviews like this with Speaker Ryan on 60 Minutes.
What is the first bill you intend to pass?
Well, the first bill we're going to be working on is our Obamacare legislation.
You're going to repeal it first?
Yes.
You're not pulling the rug out from under the 20 million people who already have Obamacare?
We want to make sure that we have a good transition period so that people can get better coverage at a better price.
So what are we talking about, months, years?
I can't give you an answer to that. We're still working on that.
But people have talked about 3 years in terms of a transition.
I don't know the answer to that right now. What we know is we have to make good on this promise. We have to bring relief as fast as possible to people who are struggling under Obamacare.
What do Republicans intend to put in its place?
Patient-centered health care that gets everybody access to affordable health care coverage so that they can buy what they want to buy.
So people will still get coverage regardless of their pre-existing condition?
Yeah, we think pre-existing condition is a very important feature of any health care system.
Children will stay on their parents' plans until the age of 26?
Yeah, that's something that we actually have always had in our plan as well.
And women will pay the same as men? That didn't used to be the case.
It depends on the age of a person. So we believe that we should have support based on age. The sicker and the older you get, the more support you ought to get. If you're a person that has low income, you probably should have more assistance than a person with high income, for example.
Is your plan going to cover everyone in America?
We will give everyone access to affordable health care coverage.
Patient-centered health care. Do you understand what that means?
Yeah, so that's the trend that's been happening across the country, which is things are getting, so if you look at health insurance back in World War II, where there were the price wage freezes and employers were just giving money in terms of benefits to workers to get them to work and to attract them to their company, healthcare essentially had a blank slate and a blank check to be as expensive as it needs to be. But before then, people were essentially insured for the big stuff. If you end up in the hospital, the insurance would kick in, and then everything else going to the doctors, it's like getting an oil change. You pay for it on your own. And that's what we're going back to.
We probably should, right? How about an a la carte without big deductibles, without big premiums? An a la carte, go to the doctor, and God forbid, all hell breaks loose. You get diagnosed with a really terrible malady, you have a catastrophic plan that covers you for the big stuff. Isn't that kind of where we need to go to save this whole thing?
Exactly. And I think that what's keeping it from happening faster is that there's very little price transparency. We don't know how much things cost. You know, if you're uninsured, you go to the emergency room, it could cost you 3 times as much as somebody that had insurance.
Just look at your bill.
Exactly.
I mean, we got a bill at the house yesterday, and it was like, okay, this is the charge, this is what the doctor paid, here's the difference, but you only owe X.
Exactly.
Meaning somewhere it's like the insurance companies are hoping that the doctor pays more, but if they don't, that's okay, because they don't really feel like they can hit us for all. It really is a confusing set of numbers that we get.
And we really can't shop around until we figure out how much things cost.
All right. Speaking of numbers, these savings accounts, FSA, HSA, you like those programs?
I do. So FSA's been around for a while, so has HSAs. Essentially, these programs allow people to stash money away pre-tax. FSA is sort of a use it or lose it type of deal, although at the end of the year, some employers you can extend it for up to 2.5 months. So that's when people start buying glasses or buying over-the-counter items.
We have an
tax-free.
HSA. It works great for us.
Yeah, and HSAs are great because it rolls over.
Right. You can invest the money in the account if you want to, if you want to get aggressive. What's the legal difference between the two?
So an HSA follows you, meaning that if you leave work, that account still follows you. And when you turn 65, it turns into a traditional IRA.
So why would you put money in an FSA if you have to use it or lose it?
It depends on the plan that you have. So if you have a high deductible plan at work, and that definition is typically $1,300 single, $2,600 family, then those types of plans will qualify you for an HSA versus.
Oh, okay.
So it depends on the health insurance.
In other words,
plan
you're
that you have.
restricted in terms of the decisions that you make.
Exactly.
Yeah, you know
Not
what?
all plans can qualify you for an HSA.
All right. In terms of worrying about Medicare, get the book or call the doctor and get an appointment, but give me the 1 minute what people need to be thinking about.
The timeline is 3 months before you retire. That's the time to think about Medicare. You got to think about your own health. The most important part is to know yourself. Understand your own health. Understand what doctors you go to, what prescriptions you take, and what your lifestyle is going to be like, especially in terms of, are you going to be staying in Rhode Island, or are you going to be moving to Florida, other parts of the country for months at a time? Because that's, starting from that point, it'll allow you to navigate the system a lot easier.
Do you need a supplemental plan? Do most people need a supplemental plan?
Most people do, just because with just traditional Medicare A and B, there's no limit on how much you can spend.
And A is for?
A is for hospital, B is for outpatient.
Okay. And the prescription?
That's D, that's separate on its own.
Whole different ballgame.
Exactly.
People get worried and confused about this, don't they?
Absolutely. It's a lot of moving parts.
Is it easier than, do you make it easier?
So that's actually the gist of the book, is that after studying it for over 3 years and helping over 3,000 individuals in New England go through Medicare, we realized that Medicare really boiled down to one major decision that you had to make. Which is? And it's pretty much a difference between what they call a supplemental plan and what they call a Medicare Advantage plan. So if you're unhealthy, or if you want the most insurance possible, if you're living in multiple states, then you might want to go for something that's going to cost you more monthly, and it's going to have very little restrictions and very little out-of-pocket expenses. Versus if you're healthy, then you go the other way.
Fascinating. As this progresses, meaning this insurance industry dilemma between the transitions, we'll have you back and we'll follow it, okay?
Thanks for having me on.
Merry Christmas, thanks, appreciate it.
Merry Christmas.
Final word when we come back. You feel better now? Sort of? Get the book. You know, we often confuse terms. There's health care and then there's health insurance for your health care. Just saying. There's a lot to think about, but I'd grab the book. Go to foxprovidence.com and start preparing for your retirement wherever you happen to be. We'll see you on the radio tomorrow at 3 on WPRO. Thanks for watching, and we'll see you back here tomorrow night. Good night.